Okay, perfect. In the last YouTube lecture, we discussed about the components of dental implant, and this was the last slide that we discussed. So that's a hex driver. So basically, hex driver is a screwdriver that helps you to tighten all the components over the implant. So they can give you this picture and ask, what is this? So it's a hex driver. Okay, so cover screw, healing cap, impression post screw, even abutment screw, all these screws are tightened with this hex driver. Now, next is the classification of implant surgery. There are two basic classifications of implant surgery. The first classification is according to the number of surgeries that are performed. The first is one stage implant surgery, and the second is two stage implant surgery. In one stage implant surgery, it means right from implant placement to the prosthetic part, you do only one surgery. It means there is one surgery in which you place that implant, and directly while placing an implant, you put a healing abutment over it, so that when the implant integrates, heal after 3 months, you don't have to do the second surgery, that's the stage 2 surgery. So this is one stage implant surgery. In two stage implant surgeries, you have to perform the surgeries two times. The first surgery would be during the implant placement, and the second surgery would be after 3 months during the prosthetic part, when you reflect that implant, remove the cover screw, and place a healing abutment over it. Okay, so that is your basically let me just see if it's visible. That's a two-stage implant surgery. Now the second classification is according to the time when the surgery is performed. The surgery is it can be an immediate implant, means the tooth is extracted and the implant is placed at the same time, so that's an immediate implant. Okay, and the second is delayed implant. When you extract that tooth, you wait for a couple of months, minimum is 3 months, you wait for a couple of months, and you place that crown, you place that implant after 3 to 4 months, that is delayed implant. Okay, but if either you're placing your immediate implant or delayed implant, if you put a crown immediately within 48 to 72 hours of implant placement, that is known as immediate loading. So loading is when you place that implant immediately after implant placement, or when you put a crown over your implant immediately after implant placement. So that is immediate loading. So now the question comes, they can ask you within what time frame immediate loading should be done. So if the options are 24 hours, 48 hours, 72 hours and 10 days, the best answer would be 72 hours. So the range is 48 hours to 72 hours. They can ask you one more question, why it should be done within this time frame. The answer is because whenever you drill, please remember again an important question. There is around 1 millimeter of bone necrosis around the implant that happens. Now, to remove this necrosed bone, osteoclastic cell will come and remove the bone around the implant. And then the osteoblastic cells will come and start forming bone. So that is why after 48 to 72 hours, the osteoclastic cells come around the implant and start resorbing that bone. So your implant becomes slightly unstable after 48 to 72 hours. So that is why it is important, whatever prosthesis or immediate loading needs to be done over your implant should be done within this time frame. Okay. So now see this. These are two stages of surgery. During the first stage surgery, you put a cover screw, that is during implant placement, and after 3 months you remove this cover screw. With the hex driver only, you'll put the healing cap over it. Okay, so that is the second stage surgery. Now the next question they can ask you, why implants are made up of titanium. So implants are made up of titanium because they are inert, they are biocompatible, they have good wettability, they have titanium oxide, they have good wettability, and when the titanium comes in contact with the environment, it forms a layer of titanium oxide. So it is this layer of titanium oxide that integrates with the bone. So they can ask you a question, what integrates with the bone? Is it titanium or titanium oxide? So it is titanium oxide. Now with good wettability, you mean that when that implant comes in contact with the blood, तो क्या होता है that blood forms a thin layer over it, and this helps in integration of that implant with the bone. So it has very good wettability. That is why titanium is preferred. Also, please remember, whenever the implant is placed, two more questions are asked, that what should be the temperature what should be the maximum temperature that can reach, means the temperature should not go above which temperature. So the answer is 41 degrees centigrade, because above 41 degrees centigrade, osteoblastic cells, they die. So that is why the temperature should not reach above 41 degrees centigrade. They ask you one more question, if the temperature reaches above 47 degrees centigrade, what happens? So please remember, when the temperature reaches above 47 degrees centigrade, alkaline phosphatase is an enzyme. It's an enzyme. This enzyme helps in bone formation. So alkaline phosphatase, it denatures, means it will not work properly, it will denature, and it will again hamper the bone formation. So agar question aata hai, what should be the maximum temperature? The temperature should be below 41, because osteoblastic cells die, and at 47 alkaline phosphatase denature. Okay. They ask you one more thing, what is PRF, platelet rich fibrin? So they can give you this image and ask you, what is this? This is a PRF. In this, the middle layer is PRF. Okay. The topmost layer is PPP, that is platelet poor plasma. And the bottommost layer is RBC. What is this? It is RBC, that is red blood cells. Okay. So you need to know how to differentiate and how it is formed. The blood of the patient is taken and it is centrifuged, means rotated in a centrifuging machine at 2700 to 3000 rpm. The range is 2700 to 3000 rpm for 10 minutes. For 10 minutes. Okay, and it differentiates the blood into three layers, that is PRF, PPP and RBCs. Okay, now these implants are made up of titanium. Now you need to understand, titanium has two important things that you have to remember when the implant is being chosen. So your implants are made up of different grades of titanium, grade 1, grade 2, grade 3, grade 4, grade 5. There are different grades of titanium. Okay, as the grade of titanium increases, okay, the strength increases, but the biocompatibility reduces. So it means we need a grade of titanium that has good strength also and good biocompatibility also. So that is why most of the implants are made up of grade 4 titanium, because it has a good mixture of good strength and good biocompatibility. So you have to remember three things about titanium. As the grade of titanium will increase, what will increase? Strength. And what will decrease? Biocompatibility. So they can ask you, which is more biocompatible, grade 1 or grade 5? Answer would be grade 1. Which has more strength, grade 5 or grade 1? Answer would be grade 5. Okay. Yeah. Okay. So now this is about titanium. So please remember the two things, tensile strength and biocompatibility, when you are seeing titanium as a thing. Now if you see your implant has this shape. Okay, it has three parts. The topmost part is the crest module. It is the crest module. This is the body, and that's the apex of the implant. Okay, so your implant basically has three parts: crest, that is the crystal part of the implant, the body, and the apex. Please remember, your implant does not have a periodontal ligament. Okay, so your implant ankyloses with the bone. So you will never hear saying someone that your implant has a periapical infection or there is a sinus tract that is formed around the implant. Your implant, always the forces are at the crestal part of your implant. Your forces are at the crestal part of your implant. So the maximum forces are at the crest module. It is at the crest module. Okay. So this body of the implant has screws inside. So whatever implant you're placing, the cover screw, the healing cap, the abutment screw, the impression post screw, they goes inside the body of the implant. So now you will always see if there is a bone loss around the implant, it is at the crest and it's like a saucer shape. It is never at the apex because the forces, like a natural tooth, in a natural tooth the forces are transmitted to the apex of the tooth. But in an implant, the forces are all at the apex. So you'll always find bone loss at the crest, not at the apex. Okay. Yeah, now a lot of people say the different sizes of implant. Like in this case, you have seen the size of the implant written here is 5 by 10. So it means that 5 is the width of the implant and 10 is the length of the implant. 10 is the length of the implant. Okay. And whatever screws come, they go into the body of the implant. So these implant companies, they come with different sizes. The width are different and the length are different. So depending upon which tooth you are replacing and also depending upon how much bone is available there, we decide the length and the width of the implant. Now there is one more important factor that you need to understand about implant is the pitch. They can ask you what is a pitch for an implant. So the distance between two threads is known as the pitch of the implant. Okay, lesser the pitch of the implant, again a question, lesser the pitch of the implant, more would be the threads, more would be the surface area. So lesser the pitch of the implant, more would be the threads, more would be the surface area of the implant. Okay. Now see, there are two kinds of surfaces in implant. One is additive surface and the second is subtractive surface. So in an additive surface, the implant companies, they put hydroxyapatite or ceramic particles over the implant. So they add some particles over the implant. So they become an additive surface. All these surface treatment increases the compatibility of that implant, the potency of that implant to integrate with the bone. The second kind of surface is subtractive. In this, the implant companies, they take some part of that from the surface of that implant, so they become rough. There are pores that are created that helps in form integration with the bone, because the bone will grow inside that pores and the integration would be better, and also the surface area, total surface area of that implant would increase. अब आपको क्वेश्चन क्या आएगा, एडिटिव सरफेस के क्या क्या एग्जांपल्स हो गए, हाइड्रोक्सी एपेटाइट एंड सिरेमिक पार्टिकल्स, एंड सब्सट्रैक्टिव सरफेस के क्या एग्जांपल्स हो गए, दैट इज सैंड ब्लास्टेड एसिड एच्ड, दैट इज SLA, एनोडाइज, इसमें इम्प्लांट को एनोड बना देते हैं और बाकी एक को कैथोड और इलेक्ट्रोलाइट में करंट पास करते हैं. एंड द थर्ड सरफेस इज RBM, दैट इज रिसॉर्बेबल ब्लास्ट मीडिया. सो ऑल दीज थ्री सरफेसेस आर एग्जांपल ऑफ सब्सट्रैक्टिव, एंड एडिटिव के एग्जांपल हो गए सिरेमिक एंड हाइड्रोक्सी एपेटाइट. See, the most common and the best surface right now available in the market is SLA. That is an example of subtractive surface. In this, the implant is blasted with the alumina particles. Now, they have asked the size of the alumina particles. The size is 50 microns. And then this implant is placed in an acidic bath. An acidic bath of sulfuric acid. Okay, a mixture of sulfuric acid or a hydrogen chloride. Okay, clear till now? Okay, now there are different kinds of radiographs used in implant surgery. One is your normal IOPA, then your OPG and CBCT. So this is a CBCT, cone beam computerized tomography. In this, they can ask you what, this is a sagittal section, this is panoramic, and the lower part is the axial section. Okay. Now we need to understand the different anatomical structures for implants. In mandible, there are mandibular foramen, mandibular canal, mental foramen, there is a loop of mental canal and incisive canal. Let's see them one by one. So this is the mandibular foramen. It is present on the lingual side of the ramus. It is a foramen through which the inferior alveolar nerve will enter inside the mandible and runs in the mandibular canal. Okay. So this is the mandibular canal in which the inferior alveolar nerve is traveling. Now you need to see when your implant is placed, your implant should be 2 mm, at least 2 mm away from the nerve. So they can ask you this question, that what is the safe distance from the nerve? It is 2 millimeters. This is mental foramen present on the buccal side. It is the foramen through which this inferior alveolar nerve will exit outside the mandible और यहाँ से कहाँ जाएगा? Buccal mucosa में. Okay. Lot of times this is visible like this. Can you see this? This is the mental foramen. कई बार इस mental foramen में there is a loop. The nerve moves forward. It moves forward, then comes backward, and then come out of it. So there is this loop. अब एक क्वेश्चन आता है, इस लूप का डायमीटर कितना होता है? इस लूप का डायमीटर इज 5 मिलीमीटर्स. तो आपको मेंटल फोरामेन से अगर आगे इम्प्लांट डालना है, कितना दूर डालेंगे? 5 मिलीमीटर्स. तो आपको इस लूप का ध्यान रखना है, प्लस 2 मिलीमीटर्स आगे. सो 7 मिलीमीटर्स आगे डालना पड़ेगा टू स्टे अवे फ्रॉम द लूप. सो अगर क्वेश्चन आता है कि व्हाट इज द डायमीटर ऑफ द लूप, द आंसर इज 5 millimeters. Now if you can see on this picture, on the right side you can see the loop with the red arrow. On the left side there is no loop, so it is not necessary that every time the loop would be present. Now can you see this branch in front from the mental foramen? This is known as the incisive canal. Your incisive canal does not supply any of the vital structures, so if your implant is touching this incisive canal also, it is perfectly fine. Now in maxilla, the most important structure is the maxillary sinus. What we have marked is the maxillary sinus. In a maxillary sinus, this is the floor of the maxillary sinus. This is the anterior wall of the maxillary sinus. This is the crest of the alveolar bone. The distance between the floor of the sinus and crest of the bone is the bone that is there for implant placement, and it is known as residual bone height. Now on this side, you can see this is the floor of the sinus and this is the crest of the bone. So that is their bone that is there for implant placement. Okay. I'm sorry. Yeah. So now very important, when this RBH, so there are two types of sinus grafting you may have to do if the bone below the floor of the sinus is less. If the height is less than 5 mm, this RBH is less than 5 mm, then you have to do a lateral window technique, direct sinus lift, in which we make a lateral window like a Cadwell loop, and then we create a window, lift the sinus membrane, graft and place an implant. But if the bone height or RBH is more than 5 mm, then we can do an indirect sinus lift. Indirect sinus lift is a procedure in which we drill through the, we do a sinus lift through the osteotomy, put the graft through the osteotomy and place that implant. So I'm just showing you with pictures. The topmost is the indirect sinus lift, where you drill up to the sinus floor. Then you lift the sinus membrane through some osteotomes. Then you put a graft and you then place an implant. So this is indirect lift. For this you need to have at least 5 mm of bone height below the floor of the sinus. But if the bone height is less than 5 mm, then you create a lateral window on the lateral wall of the maxillary sinus and lift the sinus membrane, graft and place an implant. So this is direct sinus lift or a lateral window approach. Direct because you are directly visualizing that sinus membrane with your eyes. So that is why it is known as a direct sinus lift. Clear? So that's a direct sinus lift, lateral window, put graft, and place implant. Clear? So that is all for today. We have discussed about the anatomical structures, about direct and indirect sinus lift. Next time we'll discuss about the different prosthetic options. Thank you.